Hi everyone, my name is Fatty and I'm here with Pharma Guide and I'm going to show you how to do a Medscheck using Phox today. So right when you start off, you can immediately search for your patient. So you search for the first name and the last name. And once you press enter, it'll search for your database and be able to find your patient right away. Once you click on them, it'll quickly load your patient. As you can see, the date and the time are preloaded for you. The first question that you come across is the patient diabetic? Of course, if you click no, you'll be able to continue right on through. If you click on yes, it'll add the diabetes questions there for you. Then once you get to what type of Medscheck is it, you'll be able to scroll down and see all the different options that you can choose from. And this allows you to quickly go through and select and get through your Medchecks nice and quickly while being able to discuss with your patients. So as you can see, for pretty much any option as you go through your Medcheck, there's lots of drop downs and options that you can just quickly click through. And a lot of the options will be pre-selected for you as well as things that are standards. So as you come down, your pharmacy information is all preloaded for you, so nothing that you have to do there. Your pharmacist information is preloaded as well, but you can always select on that and it'll show you the different options that you have available. So once you continue on through, you'll be able to review your patient information just to make sure that everything looks correct. The system will automatically know the primary care provider for the patient, but if it is someone else, you can always click on select a physician and it'll show you all of the physicians that have prescribed for this specific patient. As you move down here, if there is caregiver information, you can just click on there as a caregiver and add that information there for them. For allergies, it will automatically preload from your system if they are in the system. If not, you can always add some information there. Or you can check off if there's no known allergies. As you come down to lifestyle, again, it has nice, easy clicks that allow you to lead through your conversation. So if you were to say, yes, there is tobacco use, it would ask you for how many per day, and it would ask you about smoking cessation history or smoking cessation. If you were to click no, then it wouldn't ask you those questions. Once you get to lifestyle recommendations, the system will provide several options for you to select from. You can choose one or many. You can also type in your own notes as well that are customized to your patient's needs. Once you click on continue, you'll be able to see your patient's medication list. You can select all of the medications or select specific ones that you wanted to include in the Medcheck. And scroll down and click on continue. It'll automatically preload the medications for you. And as you're going through the discussion with your patient, you can indicate when the patient takes their medication. So if they take one tablet in the morning, you can put the one in the morning there. We can do a check on the compliance. So if the patient is adherent, how the patient feels about their medication, and again, some standardized options on how you as the pharmacist feel about the regimen. Again, you can always add your own notes, but these tend to be the most standard options that we see. As you go through the other medications that were selected, you'll see that the information has been preloaded there for you as well. And we'll just put some quick patient notes and pharmacist notes as well. So as you can see, you can very quickly go through the Medcheck. You can also add medications or discontinue medications and document that if needed. Once you click on continue, you'll see here in the care plan that everything has been kind of done and documented for you. There are no interactions here to be worried about from the medications that were selected. If there were any interactions between the medications, there would be here and listed for you. Once you come to the summary of discussion, again, lots of options to choose from. So you could have assessed the side effects and interactions, discussed adherence and compliance, and the list goes on. Of course, you can enter your own notes at any point in time as well. summary of patient goals, how you're going to kind of support the patient there, how the patient is going to get there, the resources that were provided to the patient to support them, and we can continue on. So once we get to the checklist for completeness here, we see that most of the things have been completed. If there were any medications removed from the patient home, you can always document those as well. And once you come to the end, of course, there is the patient acknowledgement where they can review all the terms and conditions of the Medscheck that were completed. And once they've had a chance to review that, they can just click on the button there and sign for the service provided. And we'll have the pharmacist sign as well. Once that's complete, you can just simply submit. So as you can see, the Medscheck is now complete and it's all documented on the official forms. Signatures are where they need to be. The dates are all done for you. All of the information has been completed as we had done. All of your notes from the patient, all of your notes regarding the regimen are where they need to be. You don't have to worry about signing in multiple places as that's taken care of for you. All of the patient information is repeated everywhere, so you don't have to worry about repeating any of that work over and over again. And it really just allows you to complete all of your documentation quickly and efficiently regarding the medications without having to spend all that time actually writing it out or repeating that information. So as you get down here, you'll see that your summary and goals are all completed as well. Your notification to the provider, your chart for your blister pack for your patient if they wanted one, and a note for the physician. So in a quick couple of minutes, you've been able to complete your Medscheck for your patient. Make sure that everything is well documented and make sure that your patients are taken care of. So thank you so much for joining us here for this quick tutorial on how to do a Medscheck using Phox, and we look forward to having you for our next one.